good boy. I was diagnosed in January 2009, and I had surgery, and the doctor came in and she says, don't worry, we have a treatment that we can, help you with. And obviously, because of the two other cancers of losing hair, my first question to her is not what the treatment is will I lose hair? No, you won't even lose your hair. I'm like, okay, then tell me more about it. And she says, in fact, it will be a pill. And so the whole idea of being home and getting to take a pill and not losing hair, all of that was like, wow, this is like, we finally have met the generation where, it's improved a lot since my first cancer. So we got all the way up to the Friday before, and my nurse calls at 4:45 p.m. to tell me we just found out from the insurance company that they will not cover the pill form of chemo. I automatically ask, but what can we do? What do we have to do to get it? And the nurse says, we can get it for you, but your copay for 14 days supply will be $2,000, and you need 28 days supply. So you need $4,000 copay just for this drug. At a time when you're on disability, you don't even bring in $4,000. So $4,000 going out for that is like, but you still have copay for the doctor, you have copay for the shots, you have copay for the other things that you do. You coming up with $4,000 copay is pretty much a no-brainer. If someone said we only need to do it one time, obviously you could find a way to pay $4,000. But when there's no deadline to say we're going to do 5, you don't know. You don't know. So we could not, in good faith, say, yeah, let's just keep paying $4,000 until we run out of money. We couldn't do that. So I was given the infused version of the pill. The needle that they have to put in is an inch long, and it's like a tack. It's not a needle. It's like a tack. And they have to do 1, 2, 3, and you actually cave in. Immediately after they punch this needle in, and it is a punch, and you hear it pop, you need a blood return. Well, many times they punch it in and the blood doesn't return. Well, they cannot start putting chemo through you till they know that they actually have the vein clear. So they try squeezing saline, they pull it out until they get a blood. There's been many times where I had no blood return, and we pulled it out and put it in again. I've had one time it was 3 times. I believe if I was taking the pill that every day would be more normal. I wouldn't have to, as a week is coming up that chemo is coming, I'm thinking I need to go Thursday and get the blood test, and they have to do blood actually through my port. So I do this punching of the needle 2 days in a row, and both days are not usually equal. So I start feeling bad by Tuesday or Wednesday. It's like, oh no, I don't want to go. Oh no, I don't want to go. Number one, those 2 days would go away. The fear would go away. And it's not that I think they're going to do anything wrong or they're necessarily going to hurt me. It's just like, I don't want to be one of those people. I don't want to go sit in the waiting room. I don't want the nurse to say, hi, how are you? I don't even want, I wish I didn't know them. They're all very nice, but I don't want to go in the parking lot. I don't want any of it. So I think if I was taking the pill, worst case is I would go to the pharmacy and pick up the pills. I spent a lot of years in human resources and working with insurance policies for companies, so I'm real involved and understand the bill, understand the insurance policy, understand the restrictions. So when I get my bill, I can pick everything apart, line item by line item, and know the cost of the pump plus the cost of the nurses plus the cost of the other drug was about $500 less per 2 weeks than the cost of the pill. So the discomfort and the things that I went through was $500. If they would have offered me to pay $500, I would have found $500. That was never even put out there that all of this is going to cost you. But of course the insurance company was taking over on that part of it. The pills are in my arsenal, but I can't get them. And I keep saying this is California, this is 2010. Why can't I get what my doctor wants me to have? So when people are saying, are there, how come there's not a cure to cancer? It's like, I don't know if there's a cure, but there's things we can't even have. And so to be able, for someone to tell you, you can't have this, we have it, you can't have it. I mean, that actually hurts. How do I know the pill wouldn't have been a lot easier, and maybe I would even be done with chemo at this point? I don't know. In my mind, I'm like, oh my God, the pills were sitting there, but I can't get them. I can't get them.